So, what if the key to mental health and longevity isn't another pill, but a reset for your brain? So, today's guest is pioneering treatments that are changing lives in just one day. Welcome to the Life Lounge podcast. This is your front row seat to everything happening inside Life Network. I'm your host, Karie Johnson, and each week we bring you top voices, transformational brands, and insider updates you don't want to miss. This is where self-transformation meets community, because when we grow together, we go farther. So let's dive in. So today's guest is the amazing Dr. Georgine Nanos, MD, MPH, and she is nationally recognized family physician, entrepreneur, and global leader in brain health, prevention, and longevity. She's the founder and CEO of Kind Health Group and the visionary behind Kind TMS. She's pioneering non-invasive treatments for depression, anxiety, PTSD, burnout, and cognitive optimization, all while redefining how we approach health span and resilience. She's the author of the forthcoming book, One Day to Change a Life, and the host of the Kind Revolution podcast, where she challenges outdated medicine and inspires audiences to reclaim their health with clarity and courage. Welcome, Dr. Georgine. Thank you so much for being here today.
Thank you, Karie. I'm so excited to be here.
Oh, we are so grateful. So Dr. Georgine not only is, gracing us with her presence here because she's such a the work that she does is just truly amazing. I'm so grateful for what you put out in the world, but she's also an expert inside Life Network. And we're just grateful to have her be a part of that and, contributing, some podcasts and videos and articles that she puts out there in the world. And so today I'm really just excited to kind of sit down because all of us in some way, shape, or form, and myself included, most likely have, an up close family member or personal life story of depression, anxiety, and what that can do to family. So it's such a ripple effect in everybody's life all around them, and it steals joy every single day. And just what you do is phenomenal. So I'm excited to kind of dive in and really hear, first and foremost, I love to hear the origin story. So what was kind of the moment that you realized that traditional medicine as we usually know it is failing?
Oh, yeah. Yes, I definitely have known that for quite some time. So I'm a family physician. I've been practicing medicine for 23 years here in San Diego, California. And when I first started in my career, I was in a traditional family practice, the kind where you're seeing 25, 30 people a day, no more than 5 to 7 minutes per patient. And it was awful. I didn't feel like I was being of service to my patients or to myself either. And it was just a scary and kind of awful way to practice medicine. And what I really wanted to do, I love practicing medicine. I love taking care of people. I got into medicine because I want to help people heal. But our system is not designed for healing. It's designed for just reacting to sickness. It's not proactive or preventive. And that's what I really wanted to focus on. Our current system just leaves people feeling unseen, unheard, and just very much underserved, no matter who you are. So I wanted to do something better, and within that system, it wasn't possible. So I decided to kind of break it and do something different and build something new.
Well,
And that's how Kind Health Group and Kind TMS came into being. I just really value those deep relationships with my patients. I love giving them the time and space to be heard, and it takes a lot of time.
it
And a
does.
lot of listening to really get to the root cause of what's behind a lot of what's going on with people in terms of their health, both emotional and physical. And as a family doctor, what a lot of people don't realize is mental health is really on cut. What a lot of people don't really realize is that family medicine is at the forefront of mental health. Most people, when they're having any kind of mental health or mental wellness issue, any emotional concern, they're going to see their primary care doctors first, their family doctors, their internists, or OBGYNs, pediatricians. We are really the frontline experts for mental health care. And really, until very recently, there hasn't been a lot that we can offer. So that's kind of how I got into this space, just wanting to really get away from overprescribing pills for everything and finding alternative and safe solutions for people to manage not just their mental and emotional health, but all aspects of their health, and really being proactive instead of reactive, and kind of flipping that model upside down.
That's amazing. So when did you start Kind Health Group?
So I started Kind Health Group in 2017, and we started with concierge primary care, meaning we have a membership practice. We have patients from all over the country and the world, and we can take care of them in person and remotely. And we just keep a very small panel of patients so that we can really take expert care of those patients and spend time with them. They have access to same day appointments and access to me and my team. We focus a lot on advanced preventive screenings, like we do the Gallery and the Pronuvo MRI. Gallery is a cancer test that looks at the most 50 of the most lethal cancers, and it's looking for cancerous DNA inside of your body at any one given point in time. And it's an excellent screening tool for cancer that a lot of people aren't using. We also do whole body MRI. We work with a company called Pronuvo to also, again, look for early signs of disease. And then we do advanced cardiac testing. What a lot of people don't realize, and this is where we have a lot of specialty expert, sorry, cut. And what a lot of people don't realize is that cardiac disease is still the number one killer of everyone in this country, men and women, more than all cancers combined. And there's not enough focus on preventing heart disease. So we do a lot in that area as well. We do advanced cardiac biomarkers. We do advanced cardiac imaging. So we're really digging deep to make sure our patients stay healthy and live long and healthy and fulfilling lives.
Yeah, and truly taking that preventative approach instead of just like
Yes.
people coming in with the symptoms and it's just sick care at that point, like you were talking about. And it is like,
Right.
okay, let's take a step back and see like what is really going on inside, and like, is there something that could be underlying that might manifest into something bigger, and let's get ahead of that.
Right, exactly. I have so many patients that come to me and they're like, "Oh, I'm totally fine. I only go to my doctor once a year. I haven't been to my doctor in 5 years. I know I'm good because I feel good and I'm exercising and I'm working out all the time." And that's all great. Those are all awesome things that you should be doing. But there's so much underlying disease that may be genetic or that you may be predisposed to for some other reason that you won't feel. You're not going to feel heart disease coming on, even, and we see that a lot in very healthy individuals. How many times have you heard these stories of people who, are running marathons and then drop dead of a heart attack? Well, those people most likely had underlying cholesterol and other heart disease that is
True.
typically preventable. And then same thing goes for cancer. You're not going to feel any of these things until they are really far along, and interventions aren't going to do as much at that stage of the game. So we're really trying to aggressively intervene early, looking for things that we can do to optimize our patients' health.
That's incredible. And it seems like it should be a no-brainer that every single like family practice, general practice, that should be like, you should do all of those things that you talked about, but that is like very far from what they would ever do, right?
Well, it's because it's not that in all doctors want to help people. That's
True.
what,
Yeah.
how we got into medicine. And it's not that they don't want to, it's that there's no time. And the way the current system is set up in traditional medicine, and it's just designed, it's really managed by the insurance companies and they really dictate the game. And so what they're doing is they reimburse a certain amount, what they think the time that the provider, or the doctor or the nurse practitioner that you're talking to, what they think the value of that time is. And what you would think is that with, each passing year, that value goes up. It actually is coming down. And so each year, an insurance company will say, okay, now the value of the time spent with the patient went from, like, say, $100 to $75. And so reimbursements are declining. And so what doctors have to do to keep their doors open is just go faster and faster and cut everything out. And it's not that the doctors don't want to do all these
Of
things.
course.
They're being squeezed by the
Yeah.
insurance companies, and they're really the bad guys in this picture. Most doctors that I know really care about people and want to do better, and it's just their hands are tied in that regular model of care.
Very
So
true.
it's not that they don't want to; it's that we're stuck in this just crazy system that is it's not helping patients, and it's not helping doctors either. Doctors are
Yeah.
getting super burned down. A lot of them are wanting to leave medicine and not, and not play this game anymore. And so everyone loses when that happens.
100%. Yeah. And you don't blame them too, because like you said, they're just like, it's a revolving door of these patients because they're trying to just like keep going. And
Yeah,
yeah. And then you're really not like tapping into really truly helping people like you. That's what they got in there for. So it's like,
right.
oh man, it, I feel really, really sad for the doctors that are kind of still stuck in that system because maybe they don't know how a different way. And, thankfully that you are paving the path right now with Kind Health and you have, a handful of other doctors on your team, correct?
I actually have I have 2 physician assistants. I'm the
Okay.
only doctor right now, and we have
Okay.
a team of physician assistants. We have
Yeah.
a lot of other assistants, TMS technicians. We have medical assistants on our team. We have a couple of estheticians. We have a little med spa in our practice too, which is always fun.
Yeah.
So we try to make the environment here very welcoming and warm. When you walk through the door, it doesn't feel like you're in a doctor's office. It feels like just a pretty cozy environment that's not intimidating and scary, even though, we see every range of possible disease states. We
I'm
treat young
sure.
kids like 5 and 6 year olds up to like
Oh,
97-year-olds, so, and
yeah.
everything in between. So it's a real privilege to get to see the whole lifespan, and it gives us a lot of perspective.
Oh my gosh, that's truly powerful to see. And I'm sure you probably have like stories, especially out of the, coming that you just know that of inspiration, the people that you've helped because you've truly been able to walk with them for longer periods of time and really get to know them and see them come, through the other side or, beat a disease or different things like that. Is there any that stands out and, top of mind of a good story?
Oh,
I love to hear those.
absolutely. Yeah, we have lots of good stories. We have stories on the kind of physical medicine side. We have stories on the TMS side that we can dive into, but just from some of the general medicine stories, there are patients who come to us who have been, maybe had there's one patient in particular I can think of who had a terrible cancer diagnosis and was seen at a hospital in another part of the country and had a surgery that was not corrective for the cancer, and really kind of when he went to follow up, really wasn't being heard and was being very dismissed. This is an older gentleman in his 70s, and he knew something was wrong with him, that they weren't addressing. Something had gone wrong with that surgery, and no one was really listening to him. So he actually came to San Diego and we met. I kind of did a deep dive into his story, trying to figure out what exactly happened, looking at all the records. We were able to get him transferred here to UCSD, get his care transferred to UCSD, and have one of the top surgeons in the country sort of redo his whole surgery and kind of undo all the damage from the previous surgery, whereas no one had listened to him before. And in fact, he was right. And it just took a matter of just listening to this person and giving him
Mm,
that opportunity to be heard and trusting that
wow.
he knew his body.
Mhm.
And so we were able to kind of reverse all that and get him his life back, because he was really at the end of his rope. He's like, if this doesn't get
Oh,
fixed, I don't want to even live anymore.
yeah.
So that was a pretty
Oh,
powerful story.
no
So we have
kidding.
a lot. That's the other thing we do too. We have a lot of relationships with a lot of the specialists, both in Southern California and throughout the country. So we can make these expedite these referrals and make these things happen when people have very complex cases. In fact, it's I love a good challenge. So the more complex a clinical case is, the more I enjoy it. I like solving really difficult problems.
Oh,
So to me, it's fun, but
that's
it's a joy to be able to help people like that.
that's a true doctor for you right there.
Yeah,
It's like, "I got this. Give it to me."
exactly, exactly. My friends
Oh,
call me the fixer. So
yes.
yeah.
Oh my gosh. Yeah, well, I believe it. That's so you said you see people from all over the world, and but are you currently accepting patients too?
We are. Yep,
Okay,
we are. We have to see if it's a good fit always, but we love meeting new people and giving them the opportunity to see if they'd be a good fit for our practice. So that's always exciting.
good.
And then, the other big focus that we have is on on TMS, which is the emotional and mental health aspect of our practice that we can
Mhm.
talk about when you're ready.
I would love to. Yeah, I'm very, very interested. I'm not super familiar, so please, yeah, because yeah, it seems a little like can you demystify it for me? So
I absolutely can. So yeah, so TMS stands for Transcranial Magnetic Stimulation. And the second I say that, the next words I always say are, it's not electric shock therapy, because that's what everyone thinks, associates it with. TMS uses magnetic field energy, which is incredibly safe. And it uses these magnetic waves to enter the side of the brain here on the left side, typically called the dorsolateral prefrontal cortex. And that's where our emotional regulation, that's where our emotional regulation centers lie. So for all of us throughout our lifespan, when we're, from the time we were little till like our current till current day, anytime we have any sort of negative event, whether it's a stress, a trauma, a challenge, anything that is potentially upsetting, our brain stores those memories, and you can kind of get stuck in these negative thought loops that are formed by these events in our lives. And sometimes it's really hard to get unstuck from those, and they sort of form like a traffic jam in your brain, and you can't get past them. And it becomes really difficult for people to kind of carry on with their lives when they get stuck in that place, and that can cause anxiety and depression and PTSD and a whole host of other mental health disorders. And what TMS is doing is it's using that magnetic field energy to get to that area of the brain and actually create new positive connections in the brain. It's creating, like, you can think of it as creating new lanes of highway around that traffic jam. And it's basically building neuroplasticity, which is this concept that allows the brain to sort of rework and rewire itself in a
okay.
more positive way. So after you finish a series of TMS treatments, what then happens is, when you're faced with challenges, instead of going to those negative loops like you did before, you can now access those positive pathways, and you can better emotionally regulate. You have better resilience. You have the better ability to cope with stuff. Because really, I mean, the
Powerful.
reality is, we can't like take away all the stresses in our lives. I wish we could. But what we can do is help people cope. And it's all about resilience and building resilience for people. And that's really where the magic of TMS really lies.
Hmm.
So TMS has been around for over 40 years now,
Okay.
and it's FDA approved. It's not experimental in any
Yeah.
way. We have 17,000 studies behind it, over 400 clinical trials, and probably a couple hundred million like treatments at this point. But it's really, unfortunately, it's been sort of in the sidelines of medicine for way too long. And the reason is because when it was first approved by the FDA, about 17 years ago, it was approved in this 36-day pattern. You need a lot of TMS treatments to get a therapeutic effect, typically 36 consecutive treatments. And so people would have to come to a clinic every day for 36 days, which you can imagine is really challenging for a
No
lot of
kidding.
people if, like, they don't have, if there's not a clinic near them, or if they're, obviously busy working
Yeah.
parents,
Yeah.
it's very
It doesn't
hard.
work.
It doesn't work at all. And so that was a big barrier for a lot of people to get access
Hmm.
to TMS. And then the other thing was that the devices were really uncomfortable for patients. They were sometimes painful when treatments were administered. They were hard for practices to operate and like kind of use operationally in their clinics.
Yeah.
And so what happened in the last couple of years, a lot of changes in the TMS space occurred
Good.
simultaneously that made it the reduced all of these barriers. So the first thing was that about 5 years ago at Stanford, there were a group of neuroscientists and psychiatrists that got together thinking, this is the safest treatment we have in medicine for anxiety and depression, but nobody's using it. So that's the
Hmm.
cool part. This TMS is so safe. We do it on kids as young as 5.
Wow.
It has no long-term side effects, which is not something I can say about anything in medicine.
So true.
And it's twice as effective as any antidepressant you can take. So
Hmm.
never has there been something so safe and so effective to treat such a massive problem. So
Wow.
this is the thing. Nobody was actually doing it.
Yeah.
And so at Stanford, they got together, did this study called the SAINT trial. And this was the Stanford Accelerated Protocol. And they decided to combine all of those treatments into 5 days and condense those treatments into an accelerated protocol. And so what they found is with the accelerated state protocol, patients got better a lot faster. And by like, it used to be like they'd have a 60%, 60%, 50 to 60% remission rate. And then with the Stanford Saint protocols, they were seeing more in like the 80s. So it was very, very
Wow.
exciting. Um, and so that was a big breakthrough. And then last year in my practice, we've had a TMS clinic at Kind Health Group now for about 5 years. And last year we were selected to be part of a landmark clinical trial
Wow.
looking at condensing it from 5 days down to a single day. So we
Oh my
thought,
gosh.
okay, if we can do 5 days, can we do just one? Because even
Yeah.
5 days, people would be here. We were doing a lot of 5 day protocols back in the day, and people would be here for 40 hours in the week, which was also very
That's a
intense,
lot. Yeah.
and not everyone could do that. So we started the 1 day study a little more than a year ago, and it was a multi-center study. And what we discovered was that we were getting even better results with the single day protocol than we were with the 5 day.
Wow. That's incredible. No,
I know.
I can't believe it.
It was really amazing. So it was a huge breakthrough. It was life-changing for us and for, everybody that we were treating. So now instead of having to take 36 days or now 5 days, it's just 1 day. And so the way it's administered, it's just done it takes about 5 minutes for a treatment, 5 to 10 minutes, depending on which protocol we're doing. And then you have a 20 to 25-minute break. And then we do it again. And we do 20 sessions in a day. So it's a very
Okay.
long day.
Yeah.
It starts at 6 a.m. and it ends
Okay.
at like 5 p.m.
Okay.
But then you're done.
Wow.
And so people can go home and, start to feel better like right away. So
Right
that's the
away.
exciting part. It's not instantaneous. What people will notice is that sleep really improves. That's the first thing that starts to get better. And then they'll find that kind of those negative thought patterns start to sort of untangle themselves,
Interesting.
and people feel like they can just deal with life a lot better than they did before. And
Gosh.
in our study, we had a 92% response rate and a 72% remission rate.
That's
So
incredible. Wow. Yeah,
really
so that's
amazing.
even higher than the 5 day, like you were saying, because that was
Yeah,
like 80 or something. Yeah.
yes, their their response rate was in the high 80s. So we had an
Oh
even
my
better response rate, which
gosh.
is so exciting. And so now we are the single largest center in the world that's done the most 1 day TMS treatments. So we were the first to do it, and we've been doing it nonstop ever since. And it is probably the most rewarding thing I've ever done in medicine, because for me to like help people with stuff that like they thought they had no shot at getting better from is so rewarding. And to do it so safely. Like I'm a doctor, I write lots of prescriptions, I can do that easily, but I hate it, I can't stand it. I wish, there wasn't I wish there was something other than a pill that we can do for people to get them better. And sometimes there's not, but this is a unique opportunity where we can help people feel so much better in a really safe and natural way, using your brain's own neural circuits to just rewire yourself and kind of optimize your best brain health, kind of get you back to a like a safer, more natural state where your brain likes to
Yeah.
be.
Instead of being, like, stuck in those loops that they really can't
Exactly.
get past.
Exactly.
Oh gosh, that's powerful. So I'm sure, like, what's a story that stands out from somebody that you've helped with that?
Oh my gosh, we have so many.
I'm
So I
sure.
can think of two really awesome ones. So we had the one of the first patients we treated was a gentleman by the name of Casey, and he was 32, and he had come to us really kind of at the end of his rope. He'd been depressed since he was 5. He was sexually abused at a very young age, and just was
Hmm.
feeling suicidal since the age of like 8 or 9, which
Oh my
is so,
gosh.
so sad. Really had so much anxiety and depression, couldn't leave the house, was like not really doing anything at all. Just waiting to die. And it was so painful and sad to see him. And when I saw him, this is when we were doing the 5-day accelerated program. I saw him on a Monday, and one of the things he said to me was, "Hey, if this doesn't work, I'll be killing myself on Friday," which is like the most
Whoa.
horrific thing.
Yeah.
Um, so we were all so nervous
Yeah.
and optimistic at the same time. And lo and behold, Casey did amazing. By the
Oh
end
my
of the week,
gosh.
he was feeling like much more like his normal self. It was one of the most
Yeah.
remarkable transformations I've seen, and just really
Yeah.
able to kind of pull him out and give him his life back. It happens gradually over time. It's not
Yeah.
instant, but people start to
Right.
feel that fog lifting pretty quickly. And then they get incremental improvement as the weeks go on. And
Okay.
so what we were able to do for him is really give him his life back. He now is able to go out and get a job. He's moved into his own apartment. He has friends. He's in a relationship. He's now also a mental health advocate. So, I mean, a
Oh,
total 180 on his life. And it was
yes.
just incredible.
Yeah, like it's a ripple effect. And now not only are you
Right.
helping that person, but then he's helping other people with, some similar
Exactly.
issues possibly. And yeah, it's a generational change that right there that you're doing. So,
Absolutely. And his family,
gosh.
obviously his family was so devastated to see him like that for so many years. So that was really powerful. Another really powerful story is a mom with really severe postpartum anxiety
Yes.
that we treated not too long ago. She was pretty young, in her like early 30s, and ever since her kids were born, just had this just overwhelming anxiety, just paranoid about everything, like couldn't like scared to even leave the house with her kids at times. Just everything was just triggering her. It was so paralyzing. And her husband's like, "We will do anything. Like
Mhm.
this is ruining our lives, our kids' lives."
Mhm.
So she was part of our 1-day study, and she also had a transformational effect. Within a few
Gosh.
weeks, she
Yeah.
was able to like go out, do things with her kids, take them to the playground, let them
Oh
play
my
on the swings,
gosh.
which she couldn't even do before. She was so scared all the
Oh
time.
my gosh.
So I just saw her again a couple of days ago, and she just gave me this big hug, and she's like, "You've completely changed my life. Like
Oh yeah.
everything is better." And
Yeah.
she's like, "The anxiety is gone, like gone, gone, gone. Not with no
Gosh.
pills, nothing." And
Oh my
so
gosh.
she's still, we still have patients come in for maintenance treatments every once in a
Okay.
while. We follow them really, really closely. We are
That's good.
really committed to just following them constantly. We're so annoying checking in on them. But we want to see where people are, and how we can keep them where they are. Because
Of
sometimes
course.
things happen in life, and,
Mhm.
they get some setbacks.
Mhm.
So we can always, do maintenance treatments for patients. So
Okay.
that's a really integral part of our process. We're
Yes.
very once you're a patient of ours, you're ours for life.
I love it.
We're constantly checking in on our patients and making sure they're doing
Oh,
okay, and just, we want them to
yeah.
stay well.
Well, that's just a testament again to you as a doctor because it's not just to like see you later. We actually really do care about you and want
We
you just to
do.
continue to thrive and be healthy. And so,
Yeah.
for somebody who's listening, either for themselves or a loved one, because we all have somebody in our lives that is experiencing some sort of anxiety, depression. Like, how do they know if they're a candidate for this? Like, what do they do?
So I think, if the interesting thing about TMS is it really applies to everyone. Like everyone can benefit from it. The almost everybody is a candidate. The few exceptions would be if you have a history of a seizure disorder, or if you have a history of bipolar disorder that's not been medicated, or any kind of metal in your brain, because we are using magnetic field energy. So those are really the three big contraindications. It's really just about seizure disorders, untreated bipolar disorder, and then substance use disorder also. i- TMS is used to help with substance use disorders, but it's best if someone is clean and sober before they start, so that we have those. It just takes a lot of resources when people have substance use disorders. So
I would imagine.
um, there are certain places where you can get TMS. A lot of rehab facilities have TMS devices, but
Okay.
we just don't.
Yeah.
So those are really the big things. And as long as, you are able to spend a day and hang out with us. There's lots of possibilities there. The other thing is that TMS is also being used for mental wellness beyond these extreme mental
Okay.
health disorders. And so, um, what I was saying earlier is like now there's a brand new device on the market that came out this year called ExoMind. It's made by a company called BTL. And ExoMind has completely changed the game in TMS technology. So what I was saying earlier, it was just the protocols and the way it was administered was really crappy because it took 36 days and then 5 days, and now we're down to one. Well, the devices also really sucked. And so they were really uncomfortable and painful. And now we have this amazing new device that makes the process so much more comfortable for patients. Like nobody ever complains about patient discomfort during a
Wow.
treatment, which has never happened
Yeah,
to us before.
that's
We've used a lot
incredible.
of other devices, and depending on, each treatment is calibrated for each individual. And sometimes we have to use a little more energy, a little less energy, depending on the patient. So on those patients that required higher energy, it was just for some of those patients, it was hard for them to tolerate with these older devices.
True.
Now with ExoMind, this new TMS platform, it just makes it so simple for patients. And so, um, and because now we have this easy access and a great device, everything's opening up for the TMS world. And
Interesting.
and we're using it for cognitive wellness. We're using it for perimenopausal brain fog.
Yeah.
We're using it for mild insomnia, like milder cases of anxiety, for
Yeah.
example, executive burnout. So there's really nobody who can't benefit from TMS. Everybody stands to win because
It sounds like it.
the cool part is it's about building resilience. It's making you
True.
feel mentally stronger and that you can deal with your life because
Right.
sometimes it's not that easy to deal with.
It's no, like you said, it's like we're not bubble wrapped and we will be
Right.
experiencing stressors. So it's like how could we become more resilient to handle our daily stressors as we should and not just completely, just hide in a corner. So we can live our lives in a beautiful way. So for somebody like that who is really just wanting to improve their cognitive wellness and resiliency, is that still like a same full day treatment or is it smaller?
No, no, it's
Okay.
it's it's a little bit shorter. It's modified. We do a lot of screening of our patients and really tailor the treatments to exactly what they need. So the
Amazing.
typical full day treatment is 20 sessions, and that would be for more extreme cases of anxiety and depression and PTSD. We also treat OCD. We're also able to help ad- uh, children and adults who are on the autism spectrum, help them better regulate their emotions as well.
Wow.
So that's been another area of great interest to us, and that's
Gosh,
been
that's
really
powerful.
powerful to see. So that would be the max, that 20 dose that we typically do. But for more mild disorders or just for mental wellness, you can just do 6 treatments and just knock it out in like a couple hours, or just come, a few days and do that. And not everybody can do like a full day. So we're very flexible in our protocol. We can break it up into a few days if someone, can't stand being here for 12 hours, but we try to make it pretty fun.
Yeah, oh, sure you do. Oh my gosh. You guys sound like a great team. And you got this dialed in. Like you said, you've done I don't even
We
know, like, how many.
we've done hundreds, yeah, hundreds and hundreds. So, yeah, we have it really dialed in, and we have people that come from all over the country and all over the world. So, just a couple of days ago, we had someone that came in from Kansas who had been struggling with depression his whole life, and really, again, just felt like he was, in a desperate way. And just in a few days, we've seen a remarkable transformation in him. So we feel really fortunate to be able to provide this level of care and real healing for patients in a way that I've never seen it before in medicine. So I
I
feel like
know.
it's a gift. And that's why I
It
want to tell
is.
everyone about it. I'm like, all I do is
You
talk about
yes.
TMS.
Yes. And as you should be, like, it is, we need to spread the word because like we said, like, everybody is affected, either themselves or a family member, loved one, like,
Oh,
in some
yeah.
sort of way. Maybe it's not a super extreme case, but it could be even just
Right.
something, smaller too, and they could benefit from this. And then the
Yeah.
alternatives to TMS too, like you were saying, like the other drugs that are out there, or even like the fringe ones like ketamine and things like that, or the clinics that you're sent to for like I don't even know how long. Like those
Right.
are either
Yeah.
not possible, or tell us about the
Right,
alternatives.
right. So the other, I mean, there's lots of other options out there. Therapy is a really important option, and I want to say therapy is key. Like we require a lot of our patients to be in therapy, especially those with severe depression, anxiety, PTSD. They have to be in therapy before they even start treatment here. So
Yeah.
that's
Good.
critical. Not, therapy is important, but it's hard for people to access therapists and see them on a regular basis. So there's still a great need for that. Um, Medications, SSRIs, SNRIs, those are the typical antidepressants, benzodiazepines. Those, have limited use. They work for some people. I certainly have prescribed thousands of them in my career, but they're only about like 40 to 50% effective. And an interesting thing that came out of a study done quite a while, I think it was in the 2014, around there. It's called the STAR-D trial, and it looked at the prescribing patterns of antidepressants. So the more antidepressants you prescribe and you get, if you say you are prescribed a medication for depression, say like Zoloft, and you're not responding to it, you have to wait a few weeks, 6 weeks, usually 2 months, and then your doctor will give you a different medication. Well, your rate of response goes lower with each time. So it's like a
I believe it.
diminishing returns, to the point where after your fourth medication, your response rate is like 6%.
That's
It's
horrible.
really scary. So there are if you're not a medication responder, then you are kind of stuck with not a lot of options. Ketamine is new to the scene, and ketamine is effective for a lot of people. Again, not down on ketamine, but it has a lot of its side effects too. It's, obviously causes dissociative events. It can cause a lot of psychoactive behavior, and it can have some addictive properties as well. And there's risk for misuse. And so that's the other part of it that is complex with ketamine. There are clinics that sometimes will combine ketamine and TMS.
Okay.
We're not doing that right now, but TMS is certainly the safer alternative. And then there are other things like uh, psychedelics as well, which really aren't quite legal yet, and there's still a lot of experimentation there. But I know, like, people feel scared and like kind of lost because
They
they don't
do.
have any of these options, so they're turning to some of these, unproven things that are, anecdotally seem to work for people. Like, okay, I'm
Right.
going to go with a shaman to Peru and hope it works out, which it does for some people, and that's
Yeah,
great. But like, it's so much easier and safer to do something like this, where
exactly.
we have mountains and mountains of evidence behind it. There's nothing remotely experimental about this, which is so cool.
Yeah. And like no downtime, no side effects, you said as well
Yeah,
too.
like
Like, yeah,
I
that's
can't.
incredible.
It's like every time I say it, it shocks me still, and I've been doing
Yeah.
this for a long time. I joke
Gosh.
around that it's safer than Tylenol and more effective than Prozac. So,
Yeah.
like, I'm like,
It's a
why
no-brainer.
aren't we all doing It is a no-brainer for your brain.
No-brainer for your brain.
I've done it myself. I have some mild anxiety and insomnia. It's
Yeah.
helped me just be much more calm and centered
Yeah.
and sleep better than ever. My whole
Mm,
family's done it. Everyone in my practice has done it. Everyone I know has done it. I'm
yeah.
just like, get on here.
Right. Well, it's because like, we like as a mom, or a businesswoman, a doctor, like you wear many hats in your day, Dr.
Yeah,
Georgine. It's like,
I
like
do.
we do need we need a little bit of help because like I'm a mom too, and work full time. And it's like, yeah, just the daily stressors too. And we can kind of ride that high of like stress. Like my HRV is like tanked all the time because like it seems like I'm constantly in this stress mode. I'm like
Oh
just trying
yeah.
to
Are
keep
you
all
like
this plate spinning.
living in the teens? That's where I was for a long time.
Yeah, yeah, pretty much. Yeah, it's great if
So
I get into the 20s because it's I don't know. I'm trying to figure that part out. Maybe I need to come see you too.
yeah, I think so. Yeah. And it's so true. I think as women and as like you said, women who are working and managing their kids and careers, and stay-at-home moms as well. Everybody, like, I think for women, there's so much pressure to be perfect, to get it right all the time, to just be totally on point with everything that you do, and it's just not realistic. And it is it's a stressful time for a lot of women.
Mm-hmm.
And the other thing we didn't talk about is hormonal optimization, which is something we also do here at our clinic.
Yes.
There's so much that happens as we transition through our lives as women. There are these real biological changes that kind of make us feel like we're going crazy as we,
Mm-hmm.
both in the peripartum years when we're
That's what I
having
am. Mm-hmm.
babies, and then in the perimenopause years
Yeah.
as well, that start as early as like late 30s, early 40s, where you're having these big changes. And it kind of ties in really well with TMS, because these hormones, these reproductive hormones like estrogen, progesterone, testosterone, they're not just about reproductive hormones, they're also brain hormones. So
Hmm.
estrogen helps support serotonin in our brain, our happy hormone. And so when our estrogen levels start to dip, you lose that serotonin support. And estrogen goes down in perimenopause. Same thing with progesterone. Progesterone supports GABA, which is our calming hormone. It helps keep us like calm and regulated. So when estrogen and progesterone start to fluctuate in perimenopause,
Mm-hmm.
then that's why you have these brain fog symptoms and
Yep.
all of these mental wellness symptoms that happen around menopause. It's a real thing,
It
because
is.
you're losing that serotonin and GABA support. And then testosterone also fluctuates, and testosterone also gives us energy and helps with mood regulation as well. And so when all of that starts to go out of whack, it really disturbs everything in our brain body axis. So brain body axis, sorry. So it's helping, so when we're doing TMS and doing hormone optimization, we're really maximizing every woman's potential to really kind of do what she can to live her best life. And we
Okay.
do it for
That's
men too, but
Yeah, for testosterone and just
yep.
in their different stages and phases that they go through too,
Hmm.
because they do as well. Women do.
Yeah.
Feels like we got our fair share, like more
We
if
got it way
possible.
worse. I'm sorry, guys. We have it way worse. We got a lot going
Oh,
on.
like we do.
You
Yeah,
guys
like
do
every day.
too, but
Every day, every hour. So, well, that's
right.
really good to know because there's, and I'm so glad that people are becoming, more in tune of like the different, perimenopause and menopause. Like I'm in perimenopause myself right now, so I'm very curious because yeah, I definitely noticed some changes already too. So it's
Yeah.
that's good to know that so TMS will help with that as well as hormone regulation too
Right.
that you guys do.
Yeah.
Okay. That's so good. So what else what can you not do, Dr. Georgine? That is the question. You guys do
I
a
don't know.
lot.
I do a lot.
You
Yeah.
guys do a lot. Oh my
We
gosh.
do. We do.
Oh my god. Okay, so for somebody who they think that maybe depression is just like a chemical imbalance, what do you explain how can you explain that to somebody, like what is really happening within the brain? Because I'm sure there's going to be a little bit of people who are a little bit more curious about that.
Yeah. So we used to think for a long time that the depression and anxiety were based on a chemical imbalance, and that is true to an extent. But what we're finding as neuroscience advances, especially in the last decade, is that it is a function of neuroplasticity, and there is the ability with neuromodulation like TMS, and energy-based devices to actually create these new synapses in the brain, and sort of upregulate these signals that have been depressed through like anxiety, depression, and other mental health events. So it's not all about the chemical imbalance. It's more so we're finding that it is these neurotransmitters, and their synaptical connections at more of a neuroscience level. And so if we can fire them back up rather than flood the body with chemicals that we do when we're taking pills,
Mhm.
then you can simulate that same effect. So when you're taking a pill, for example, it's systemic. It goes all over your body. It's your dog wanting to join.
It's crazy.
Um, so then the difference with neuromodulation devices like TMS is you're really targeting just that very local area of the brain that needs help and trying to bring it back online by stimulating the brain to do its own thing, to rebuild those synaptical connections and build these new positive pathways. So it's kind of a new way of looking at brain health and how our brain works and functions.
That's powerful. Okay, that's super helpful because I know I have some friends who say that sometimes that it's a chemical imbalance. So it's good to have that clarity because I know I'll
Yeah.
have some questions on that. So we love to make sure we kind of wrap up just almost like a little more personal way, just so people could get to know you. And it's kind of like a rapid fire.
Oh yeah, I love
So
it.
I know those are always fun because I always love to listen to those on podcasts too. So what is a wellness habit that you personally swear by?
Oh my gosh, I love walking on the beach. I'm very lucky to live in San Diego. So every day, every single day of my life, even if I'm here, I'm always walking on the beach after work or in the morning. It's like my happy place. It's like meditative. It's so grounding and awesome. It's
Yeah,
the
the
best.
ultimate grounding right there.
Yeah.
Oh, I love it. Oh, so good.
Yeah.
Okay, what is one thing that you wish more women knew about their health?
Oh gosh. You know what? I there's so much, but I would say probably the most powerful thing is that they should advocate, that they can and they should advocate for themselves. So,
Yes.
in this world of 5-minute visits, you have to speak up. You know your body better than anyone else. So, say what you need to say. And if you're not being
Yeah.
heard, go somewhere else. There are so many doctors out there that want to help, that want to listen. So, I think that's the most important thing is that we
Amen to
need to
that.
advocate for ourselves. And one more, we need to put ourselves first. It's that whole like put the oxygen mask on first. We're doing everything for everyone else, like our kids, our spouses, our loved ones, our parents. You're not serving yourself and you're
Mhm.
draining yourself completely. And so the more you can, it's not selfish, it's self-care, and that allows you to take care of your army of people that you're always caring for.
Such both very, very valid and very true points. Thank you for pointing those out because it's a struggle for women.
Yeah,
It's really hard to put ourselves first, but it makes sense, because you can't pour from an empty cup. So good.
exactly.
And then what is a belief or habit that you've outgrown, and then something that you're replacing it with, or just something you no longer believe?
Hmm.
Put you on the spot there.
Oh, well, you know what? This is very medical, but so when I was first being trained in medicine about 25 years ago, there was a very popular belief at the time that hormone replacement therapy was dangerous for women. And we grew up with that in our medical careers for quite a long time, the last 2 decades. And it was through this study called the Women's Health Initiative that they found later to be, have a lot of flaws in it. And so now the pendulum has swung the other way, and we're really promoting hormone health and hormone optimization. So that's a big thing that I've changed my tune
So
on.
a huge shift, which I'm grateful for now that, I'm in
Yeah.
perimenopause too. I'm like so glad that they're
Right?
shifting that too, because there's thankfully ways that we can get help. We don't have to suffer. And it's
Exactly.
like, whew, that was a scary time.
Yes. Yes.
Oh man. Okay. And then, so the beginning of the day, I know you love to ground. Then what is your favorite way to reset after a stressful day?
Ah, I I just love hanging out with my friends and my family. I have these two
Yeah.
amazing sons. I have wonderful friends. I'm a very social person. I like hosting like friends for dinner at my house, and
Yeah.
yeah, I just like connecting with people who I love.
Oh my gosh, that's so good. Yes, you're such a good person. You love to help people, and I can see that, just having that energy around you too. So Dr. Georgine, can you please tell people where to find you, all of those important things, and then if there's anything else that we left out that you need to share?
Yeah, absolutely. So you can learn more at kindtms.com and also kindhealthgroup.com. We have two websites. For more of the main practice, and the other one's dedicated more towards TMS. I also have my own podcast called The Kind Revolution, where we're trying to
Yes.
change mental health and all of healthcare and build it better. And then you can also find us on Instagram at Kind Health Group. And yeah, we just want you to join the revolution with me and build a better healthcare system. That's what we're all about. And I want to empower as many patients as possible to focus on prevention and brain health and longevity and just be truly well in the best possible way.
That's so good. I love that you're calling it a revolution because that's what it is. And it's a true movement and you're truly taking it just like it's way beyond science. It's hope. And that's what I really felt from this episode from you too. It's and that healing is possible. Like and
It
it can
is.
and it can happen in a faster and more gentler way that we've been taught to believe. So
I know, and
I'm grateful.
to do it safely, that's the
Yes.
big thing. There's so much out there that that people are trying, and I get it because they're so desperate, but so much out there that people are doing may not be safe, and I think, having that safety and efficacy is, like, is
Mm.
huge.
So, so true. Oh my goodness. Well, Dr. Nanos, thank you so much for showing up today so fully for our audience. And I know that there's so many people that were, tuning in. It's either themselves or a loved one. Let's keep this conversation alive. Let's make sure to share it with those that need it. That change is possible, and it might just be one day. That is all that it takes.
I know. Thank you, Carrie.
Oh
I'm
my
so
gosh.
grateful for this opportunity. This is great.
Thank you, Dr. Georgine. And for everybody, make sure to tune into Life Network and follow Dr. Georgine as well, because when we grow together, we go farther. See you next time in the Life Lounge. Thank you.